Attain for the treatment of bladder and/or bowel leakage. Attain treats urinary and fecal incontinence in women. Attain consists of a handheld control unit and an inflatable insertion probe for vaginal or rectal use. Before you begin using Attain, please read the manual and patient card. Prior to your first use, you should clean your inflatable probe with a mild soap and water. While the Attain is powered off, inflate Attain enough to ensure a thorough cleaning of the folds. Using a soft cloth and a mild, unscented soap and water, wipe the probe handle and the cord gently. Rinse and dry thoroughly. Deflate the probe by pressing the air release valve. Using the screwdriver provided, loosen the screw on the battery cover by turning the screwdriver to the left. Remove the cover. Now insert 4 AA batteries in negative and positive direction as indicated. Replace the cover and tighten the screw by turning to the right. Power Attain on by pressing on-off power button and verify power indicator light illuminates. After testing the power, please power off by firmly pressing the on-off power button. Before you begin, use the restroom, if necessary. Please have your Attain and In Control medical gel available. It is most comfortable to complete your session while lying in bed. Please choose your position based upon use. On your back for vaginal insertion, on your side for vaginal or rectal insertion. For rectal use, it is most helpful to lay on your side with the dominant hand free to use for insertion. Apply a dime-sized amount to tip of device and pinch the probe to collapse the folds for easy insertion. The silver stimulation contacts and arrows should be facing hip to hip. Insert the probe into your vagina or rectum to the handle. Hold the probe in place. Power on by pressing the on-off power button and follow the screen for visual cues. While viewing the display, inflate the probe by pressing the bulb until the arrow is located within the white shaded area and the probe feels comfortably snug. Your inflation number is located in the corner of the display. Typical range is between 12 and 18. The screen will then display Start Stimulation. Press the up arrow to begin setting stimulation level. Begin at level 1 and increase stimulation slowly, pausing a few seconds at each level until you feel a comfortable full muscle contraction. Your pelvic muscles will contract around the probe and feel as if they're pulling upward and inward. At any time the sensation feels too strong, you may use the down arrow to decrease stimulation level. Once you have set the appropriate stimulation level, relax while Attain stimulates your pelvic floor muscles for 7 minutes. Your display will count down the minutes. At the end of the stimulation session, you will begin your biofeedback session. Press the play button and follow the visual cues. Relax your pelvic floor muscles. Now slowly contract your pelvic floor muscles, raise and maintain the lights. Now relax. At the end of your biofeedback session, the display reads "Session complete," and the device automatically powers off. Deflate the probe by pressing the black air release valve. Remove the probe and clean as directed in your manual. Use Attain 1 session per day, 6 times per week, until your symptoms resolve. Then you may move to a maintenance program of 1 or 2 times per week to maintain results. Attain by In Control Medical.